Greetings of the day. Today Dilip is with some of the explosive questions in physiology, which are the commonest type of questions in most of the entrance examinations, including the Union Public Service Commission examinations or NEET or AIMS explorations or various medical entrance examinations. So let us see how these questions are coming in physiology. So this is an overall presentation and I will try to cover up some of the questions, how to answer them, how to approach them, so that in the future time I am coming with thousands of such questions, their answers, their approach, and a clear-cut physiological basis behind those questions and their answers. So let us begin with this question first. So the question number one question, some options. I'll wait for 5 seconds, then I'll tell you the answer, why the answers are not others, and what is the logic behind these answers. For example, the first question is, which one of the following cell shows fastest diapedesis? This is the question. And what are the options? The option is the erythrocyte. Just see the options very properly. B, the basophils. C, the neutrophils. And D, the eosinophils. Suppose this is the question. 5 seconds. Just have a look to this question. And guys, when this type of question comes, you have to be very careful because this question contains two different words. One is fastest. That means it should show a kind of diapedesis which is said to be faster compared to others. And when I am saying diapedesis, it means it is actually the squeezing movement of leukocytes across the endothelial cells. That means they will migrate from the inner of the blood vessel, that is endothelial lining, and they will reach the tissue spaces where actually the organisms are present under a chemotactic gradient. They will be attracted towards that site. A lot of mechanisms are there, that those we will cover in the lectures, and thereafter it will carry out phagocytosis. So here I am having two words. One is fastest, second one is diapedesis. Now coming to the answer, erythrocytes are the cells which are most abundant. They are commonly known as the red blood corpuscles, but they do not show diapedesis. Basophils, these are the smallest kind of leukocytes, around 6 micron in size. These are not motile. They do not show the diapedesis. Means erythrocytes wrong, basophils wrong. Coming to the neutrophils, the first line of cellular defense, very active phagocytic in function. They are the part of the non-specific immune system. They change their shape, they show rolling movement, they show migration through the endothelial lining. That means these are the cells which show diapedesis. Now coming to the eosinophils, yes, they are another category of granulocytes. They are not motile like that of the neutrophils. Even they do not show diapedesis in that manner how the neutrophils exhibit. So in this question, now the answer is neutrophil, and that is the answer is C. So these type of questions are usually asked in entrance examinations or anatomy physiology examinations. And here, when this type of questions come, always it is my advice that find out the wrong answer, because why not the others? They seem to be similar, but you have to find the answer. Now coming to the second question. Let's see, means how the questions are going on. These are common questions from various parts of physiology. I have not classified anything. Question number 2. Now question number 2. Which one of the following acts as a cholesterol remover or acceptor during sperm capacitation? I have taken so many capacitation lectures, so this is a common question which comes, that which one of the following causes the removal of the cholesterol? That means that is classified as a cholesterol acceptor. Option A, cyclic AMP. Option B, that is a very common one, that is bicarbonate. Option C, phospholipids. Option D, albumin. Now 5 seconds starts from here. Take your time to see the question. This question is saying which one of the following is removing the cholesterol. You should understand that the sperm membrane containing the cholesterol is one of the most important regulators of membrane fluidity. Unless and until this cholesterol is removed from the sperm membrane, the capacitation cascade is not going to start. That means there should be removal of the cholesterol, and the take home message is it is the first step where the cholesterol has to be removed. Now where the cholesterol is removed? Now it is in the oviduct. Oviduct has high concentrations of bicarbonate, albumin, also phospholipids. So who is that? Who is causing either the cholesterol removal or accepting the cholesterol so that the cholesterol is removed? The cyclic AMP? Never it is the answer, because it is the intracellular messenger. It is produced when the bicarbonate goes inside, and then the soluble adenyl cyclase enzyme is activated and it forms cyclic AMP. So it's not the answer. Now coming to phospholipids. Yes, phospholipids are present in the oviduct, but they are not the acceptor of cholesterol. They cannot bind with the cholesterol like the other, which is the answer. Bicarbonate. Maximum concentration of bicarbonate is found in the oviduct, but it is not the answer, because it is that which enters the cell membrane to bring out intracellular alkylation and further downstream events. So the answer is the albumin. It's a very common question, and the answer is albumin. It is commonly known as the cholesterol acceptor, and it removes the cholesterol so that the fluidity changes, membrane gets reorganized, and then the process of capacitation begins. So this is our question number 2 today. Now coming to another very important question. Question number 3. Question number 3. Which one of the following best represents the resting membrane potential of sino-auricular node, that is commonly known as the pacemaker of the heart, the sino-auricular node. And here options are minus 65 millivolt, minus 85 millivolt, C, minus 25 millivolt, D, minus 55 millivolt. Take 5 seconds. So read the question properly. Which one of the following best describes the resting membrane potential? I can say RMP. When there is no stimulation is there, what the membrane shows, the charge distribution across the membrane of the cell is almost making it into an equilibrium stage. There is no conduction of impulse. And the second part is sinoauricular node. It is known as the autorhythmic structure of the heart, commonly known as the pacemaker. It shows auto leaky channels. Therefore, due to the leakage of the sodium, it is said to be auto-excitatory in nature. And now we have to understand, due to this SA node, that is pace conduction is there. I have explained in that pace conduction lecture in detail. So here my question is, what is the resting membrane potential of sinoauricular node? Now if I can go and directly say this answer is minus 55 millivolt. So this is now the point that why minus 55, minus 25, we just leave it, it is not the answer. Minus 65, minus 85, some are answers, maybe nerve, maybe skeletal muscle. But here in this specific question, the answer is minus 55 millivolt. Now I keep it as a suspense. When I will come into my next explosive series, I will definitely ask this question to all of you, that why sinoauricular node shows a resting membrane potential of minus 55 millivolt. So stay tuned for that answer, for that question and for that answer. We will discuss. Now coming to question number 4. Question number 4 is a bit tricky. Just try to see how the question is being framed. Question number 4. Which one of the following is the regulator of aldosterone secretion? These are all level 1 questions, means low to medium level. I have framed the questions from medium to high, high to high. So we will gradually see in our forthcoming presentations. But today I am showing the level is just low to medium. Which one of the following is the regulator of aldosterone secretion? You can say all may be appearing to be the answer, but try to see one is very, very important in regulating aldosterone secretion. So let's see. Number 1, water volume in extracellular space. This is first. B, high sodium, that's I can say hypernatremia. C, high potassium, that is known as hyperkalemia. Or another one, the D, high Cl minus chloride in extracellular fluid. See the question for 5 seconds, then I will tell you the answer. This question is about which one of the following is the regulator of, that means which will cause the secretion of the aldosterone from its part. Aldosterone is a mineralocorticoid. This is secreted from the zona glomerulosa of adrenal cortex of the adrenal gland. This hormone regulates the fluid and electrolyte balance. So this is one of the most important hormone which balances that in our body. This hormone has multiple stimulants to be secreted and to bring out the action. It potentially acts on the renal tubules, distal convoluted tubules and collecting tubules, specifically collecting tubule area, where it is causing the retention of the sodium. It means it has to retain the sodium. So now question arises, what will trigger the secretion of this hormone? Here the options are very, very different, no doubt. But it has been seen that renin, angiotensin, aldosterone system, that is my coming lecture. In this system, renin, angiotensin and angiotensin associated, like angiotensin 1, 2, 3, like that. Out of that, angiotensin 2 is a potential stimulant of aldosterone secretion. But here there is no option like that. Now the point is that for the secretion of renin and thereafter the formation of the angiotensin 2, who stimulates that? So that the cascade will begin and the aldosterone is going to be secreted. Water volume, no doubt, it is a regulator of fluid volume in the extracellular space. So this is one of the answers, but not appropriate, but it is one of the answers. High sodium, yes, it is a sodium regulatory hormone, but high sodium cannot secrete it because it causes the sodium to retain. That means low sodium may be a stimulant, but high sodium cannot. So it's a wrong answer. High potassium, we have to understand that what is that high potassium and how it is going to be. High Cl minus has no sensors for this particular purpose, and that's why Cl minus is not the answer. High sodium is not the answer. Water is not the answer. Rather, hyperkalemia is the answer. This is known as the most potent stimulant of the kidney tubular cells for the renin secretion. So we have to remember, is it hyponatremia, that means decrease in sodium, or it is hyperkalemia, that means increase in potassium is the regulator. Both are the regulators of aldosterone secretion, no doubt. But when both the options are there, it is the potassium sensing system which is more active in the kidney tubular cells. So here the answer is hyperkalemia. So this we have to remember. This is one of the very, very fundamental question I have seen in several entrance examinations, competitive examinations. People want to test you, and this is the exact answer. So do not get confused. High potassium is the most appropriate answer, and this is the potential stimulant of aldosterone. Now coming to question number 5. Question number 5. Question number 5. During freezing of cells, which one of the following is used as a cryoprotectant? So burning question, very favorite nowadays, because we know that freezing of the cells nowadays is the common practice. In most of the tissues are said to be freezable, most of the cells rather. They are kept in liquid nitrogen for a long period of time. In animal science, this is extensively practiced for the sperm, the embryo nowadays. So it's a very common thing that which agent which is going to protect the cells from cryogenic attacks, means the attack from the low temperature. They will prevent the formation of the ice crystals, because you know that wherever the water is there, when once it comes to the freezing temperature, then the water crystallizes. So that is the role of the cryoprotectant. They will not allow the formation of ice crystals. Now see the options. Option A, trees. Option B, EDTA. C, glycerol. D, sodium citrate. This is level 1 questions. When level 2 questions will come, I will give little bit more close options so that confusion will arise. But still, it's an important question. In this question, trees is a universal buffer which is used in semen extenders, in embryo preservation mediums, and mostly it is a medium which try to make the pH in a constant zone, means a buffering action. EDTA, ethylene diamine tetraacetic acid, this is commonly used as an anticoagulant, a calcium chelator. This is also used in electrophysiological recordings to chelate the calcium. No doubt it is weak compared to the EGTA, but yes, it is commonly used. Sodium citrate, yes, it's an agent which is used sometimes for a source of energy because it so provide the citrate, and also ionic balance because it is having the sodium. And now the answer is, here in this question, the answer is the glycerol. In semen fishing, it is used at the level of 5 to 10%, depending on the animal species, but just in a reference zone. So it is the most commonest agent which is used for this bridging cryoprotectant function. That means it's a potential cryoprotectant. So from here, a question comes to my mind which is kept for the next, that is level 2. What actually glycerol causes so that it acts as a cryoprotectant? So this is my next question and it will be in the level 2. Stay tuned for this question, find out the answer, and let's see how much you are tallying your answer with my question and my answer. So the question is, how glycerol acts as a cryoprotectant? That is our next question. Now see question number 6. Question number 6. Question number 6 is another applied question, but level 1. Which one of the following acts as a calcium binding protein? A calcium binding protein in skeletal muscles. I'm giving the option: A, myosin, B, actin, C, troponin C, D, calmodulin. These are the points. Take 5 seconds. What is the question? The question is, which one of the following acts as a calcium binding protein in skeletal muscle? Be careful, because here 3 parts are there. One is calcium binding, that means that which will bind to calcium. This is one. Second, it's not an ion, rather it should be a protein. So this is the second part. It should be a protein. And third, this question is related to skeletal muscles. That means it is not to the smooth muscles, not to the cardiac muscles. Specifically, this question is meant for the skeletal muscles. Myosin is the high molecular weight protein, most abundant protein in the skeletal muscle, forms the myosin filaments or the thick filaments. Actin is the second most abundant protein, forms the thin filament or actin filament. During muscle contraction, actin filaments slide over the myosin filaments, leading to reduction in the length of sarcomere, and that's what known as muscle contraction. Troponin C is the part of the troponin complex. This troponin complex is present in skeletal muscle and cardiac muscle, not in the smooth muscle. The troponin complex shows 3 subunits: troponin C, troponin I, troponin T. All are having different functions. And calmodulin is found, this protein is found in case of the smooth muscles. It is not there in the skeletal muscle. My question is to the skeletal muscle. So we can understand that this protein has a calcium binding role, no doubt about that, but not in the skeletal muscle. So this is the wrong answer first. Then second, myosin, it has no calcium binding unit. Actin, of course, the part troponin complex is the part of the actin, but here actin is not the direct answer. So the answer is the troponin C, which is the calcium binding site in case of the skeletal muscle and cardiac muscle, not in the smooth muscle. So the answer is this C, that is troponin C. Now get ready for the level 2 question. The question will come. I will give 4 options, different types of muscle, different types of calcium binding unit, and you will say me that which one is not a calcium binding unit in this muscle. That is our level 2 question. So we'll see how this is. So in the level 1 we just find out what is that which is binding to the calcium, and we form the answer as the troponin C. Now question number 7. Question number 7. What makes the formed clot to become hard, dehydrated, and is converted to stable clot? This is a typical question. A bit, there are multiple points we have to see. A, it is what makes the sperm clot to become hard, dehydrated, and is converted to a stable clot? Answer. Options: erythrocyte piling up. B, phagocytosis by leukocytes. C, platelet activation. And D, clot retraction by platelet proteins. Take 5 seconds. Try to understand the question and find out what will be the probable answer. This is a level 1 question, you can say, level 2 question you can say. Because whenever there is an injury occurs to the blood vessel and endothelium is damaged, the collagen surface is exposed, the blood comes out, then the platelet aggregates after their activation and forms a soft clot which is unstable, jelly-like, primary blood clot. After some time the fibrin gets deposited and the fibrin gets stabilized by factor number 13, fibrin stabilizing factor. It becomes stable. It is jelly-like, it is hard, it's soft, It takes around 30 to 40 minutes of time. Then the serum comes out. The serum. Then the clot becomes hard, small, tight, and very stable. It prevents oozing out of the blood. So that is this question is all about. What makes the formed clot to become hard, dehydrated means that is the serum which comes out and is converted to a stable clot. That means once serum comes out, becomes hard enough. Erythrocyte piling up. We know that the clot under the microscope appears like this. These are the fibrin threads. These are polymerized. Fibrin is formed from fibrinogen in the presence of this thrombin. Thrombin is formed from prothrombin, and prothrombin is converted to thrombin in the presence of prothrombin activator. Prothrombin activator is formed by intrinsic and extrinsic mechanism. My coming lecture is on coagulation of blood, so we'll discuss, no doubt about that. For the time being, it is a polymerized fibrin which are showing the RBCs also along there. But whether it is the erythrocyte piling, means aggregation or adherence of the erythrocyte, that make this clot to retract, that makes the serum to come out, answer is no. Even though the erythrocytes are present, they are not contracted. Second, phagocytosis by leukocytes. Here leukocytes are present. They are trapped. But do they do the phagocytosis? That's why the clot becomes hard or dehydrated? Answer is no. No, it is not applicable. Third, one of the important point, confusion arises between C and D. Platelet activation. We know that in the normal circulation, when the blood vessel is intact, endothelium is continuous, the platelets are usually inactive. But once the injury occurs, endothelial surface is exposed, then they become activated. That we will discuss later on. These activated platelets bring out this clotting cascade. By themselves, they are self-capable. That's why in their deficiency or in their count, if it is decreased, then clotting disorders occur. That also we will discuss. So few people think it is the platelet activation that makes the clot retraction. That's fine. Answer is 50% correct. That's fine. I'm not saying it's a wrong answer. But which is the appropriate? Clot retraction. This is the word, what I was saying. 30 to 40 minutes after the formation of the clot, that the clot will retract. Retract means reduce its size. Becomes hard, dehydrated, and stable. So that is mediated by the platelet protein. And these platelet proteins are present inside the platelet. Once the platelet is activated, they are known as activated platelets. In the presence of the calcium, they are being released. Thrombostatin, that is a protein is there. And that protein causes the clot retraction. There are several contractile proteins are there, we will discuss. But one of them protein is that. That causes the clot to retract. And that makes the clot hard. So here in this question, the most appropriate answer is the D. That the clot retraction by means of activated platelets and they are releasing proteins that makes the clot to retract. Coming to question number 8. A bit easy. A direct question. We'll try to see what may be the probable answer. Question number 8. Which one of the following forms the blood-brain barrier? It's a typical choice, no doubt, level 1 question, but it is a fundamental question mostly asked in various examinations. I can give you the options. Microglia, B, oligodendrocyte, dendrocyte, C. This is a very important question to remember. That is Schwann cells, and D, astrocytes. Try to understand this word blood-brain barrier. The endothelium and neuron, they show an interface. Here the blood is not coming in direct contact with the brain or the brain cells. Rather there is presence of a barrier, and this barrier is present by means of the protoplasmic process of a cell, a star-like cell. This cell form a tight junctional complex across the endothelium, so that the constituents of the blood are not directly entering the brain cells, that's the neurons. That's being known as blood-brain barrier. A reduced permeability is being seen at this interface of the blood and brain. That's why it is known as blood-brain barrier. We'll discuss in one lecture what is blood-brain barrier, what is its clinical significance, what is its physiological significance, what is the anatomical significance. For this class only, for this particular question, microglia, it is nothing but a phagocytic cell present in the central nervous system, and it is not said to be the part of the blood-brain barrier. It is phagocytic in function, just like the leukocytes in the blood, but it is not a barrier one. Second, oligodendrocyte, it is another cell which is almost a flag-shaped cell. It is said to be a myelin-forming cell. It is present in the central nervous system, but it's not a barrier. It doesn't interact with the endothelial cells. Schwann cells, it's another myelin-forming cell in the peripheral nervous system. It is regenerative in nature. That's why peripheral neurons, if they are damaged with the myelin sheath, they may show regeneration. It has nothing to do with the blood-brain barrier, so it's not the point. Now the point comes to the most important non-neuronal cell, and that is known as astrocyte, a star-shaped cell, two types, protoplasmic and fibrous astrocytes. This is not the right time to discuss a detail, but yes, these are the cells which form the linkage among their protoplasmic process along the endothelial cells, so that there is a barrier is formed, a layer of barrier is formed between the blood and the brain, and depending on sweet permeability or desirable permeability, substances will enter. So the answer of this question is this astrocyte, which typically form this blood-brain barrier. This is a very, very fundamental question, a question of choice for all. Now coming to the next question. This is all level 1, level 2 slide. We'll see another level 2, level 3. There are so many levels up there if you really want to crack competitive examinations. So physiology has no outline. It is in depth. So many questions can be framed, but looking to the syllabus, looking to the label, usually the question setters set the question. So we have to go in that way itself. Now coming to the question number 8. Which one of the following nerve is activated due to slow or conscious breathing? Nowadays it is the most burning question. It's an age-old concept that if you are having stress, anxiety, mental restlessness, then it is usually said that calm down. Go for a meditation, go for slow breathing, conscious breathing, inhalation for some time, exhalation for a long time, very slow and knowing what you are doing. Then our nervous system calms down, heartbeat goes down, restlessness is converted to restfulness, and brain becomes calm, you become focused. That stress, anxiety like phenomenon, it goes away. And that is by means of conscious breathing. Now my options are A, olfactory nerve, B, facial nerve, C, trigeminal nerve, D, vagus nerve. This comes as a question, usually. It is known as the olfactory nerve. The name indicates the sense of olfaction, that is smelling. This is the cranial nerve which regulates our smelling. It's a chemo-associated neuron. Facial nerve, the 7th cranial nerve. It is responsible for the facial expression. It supplies to the facial muscles and various other functions. Trigeminal nerve, commonly known as dentist nerve, you can say. This is the 5th cranial nerve. It is one of the largest nerves in this sense. It is having large number of branchings. The 10th one is known as the vagus, and this vagus is predominantly a nerve which provides to our visceral organs, including the heart. it slows down the heartbeat when it is activated because it releases acetylcholine. So friends, the answer is not olfactory nerve, not the facial nerve, not the trigeminal nerve. Here the answer is the vagus. The parasympathetic activation occurs when you do the slow or the conscious breathing, that which makes your nervous system to become calm. Your heartbeat slows down. Focus starts. So that is due to this vagus nerve. So the answer here is the vagus nerve. Okay. Now coming to the ninth question. The ninth question. A very generalized question. Ninth question, you see. The question is, which part of the nephron shows highest reabsorption of glucose? This is level 1 question, direct answer. The option A, that is glomerulus. Option B, the proximal convoluted tubule. Option C, the loop of Henle. This is level 1, the NEET level question. D, the distal convoluted tubule. 3 seconds. It's a level 1 question, direct question. Nephron is the unit of kidneys. Around 1 to 2 million are there in both the kidneys. They are having different parts. Nephron lecture is on the way. Very soon you will get the detailed organization, functional and structural organization of nephron. There you will see that this is one of the structural and functional unit of the kidneys which are responsible for this filtration of the blood leading to formation of this urine. We will see in the detail. And during this process, there are 3 events occur: glomerular filtration, selective reabsorption, and tubular secretion in various parts of the nephron. And there, the reabsorption is a phenomenon in which essential substances which are not required in the urine, they has to be retained by the kidney tubule so that they will return to the systemic circulation. And here the compound I have taken, that is glucose. Usually glucose doesn't appear in the urine. It is retained in the body, and once it crosses the renal threshold value, then it comes into the urine. That is a point of discussion in our coming lectures. So now my question is, where this glucose shows maximum reabsorption? Is it glomerulus? No, dear friends. Glomerulus is the site of filtration. Here no absorption occurs. So it's not the answer. So glomerulus is gone. Loop of Henle. Loop of Henle is the segment where water gets concentrated, salts get concentrated. It is one of the segments which makes the urine to be concentrated, site of counter current mechanism as well. It maintains the hypotonicity of the urine. So it is not the answer. It is not the site of absorption of the glucose. Distal convoluted tubule. It's a facultative area of water absorption under the influence of the hormone ADH and the aquaporins. Here aldosterone also acts for the retention of the sodium and removal of the potassium. Here water is important, and that too I am saying it is facultative, hormone dependent. There is no term like glucose which comes here at the terminal segments of the nephron, that is DCT. So here the answer is proximal convoluted tubule, the longest part of the nephron, not the loop of Henle, this one, longest part of the nephron. Maximum reabsorption occurs in this part, 70 to 80%, both by active and passive mechanisms. And the glucose, amino acids, that which comes after the filtration from the glomerulus to the tubule, they are all along absorbed in the PCT. So the question answer is proximal convoluted tubule, which serves as the maximum site of reabsorption of glucose, almost 100%. No glucose will pass the PCT and will come to the loop of Henle or to the DCT. So here the answer is proximal convoluted tubule. Now coming to the last question of this particular explosive series, and this question is here, that is the question number 10. Let's see. The question number 10 is the last question of this. Remember students, I am coming with such type of questions in thousands. I have divided many series. I will say this type of questions randomly. I will tell you the answers with physiological basis. I have also designed chapter based questions which will come chapter wise. Those which are really expected in examination, so that you people can come, attend this lecture, get benefit. I will always get ready for your comments, suggestions, any queries or any further improvement in this. So that's why I always say that subscribe the channel, like the channel, and please keep alert for notifications that when what is coming, so that both side interaction will be there and both will be benefited. So the last question of this, I have fixed it in between level 1, level 2. The love hormone, oxytocin, predominantly has its receptors on which target cell? This is the question. And we know that oxytocin, D. Vigneault was the person who discovered this and got the Nobel Prize. This is one of the most discussed hormone, and I am having a complete lecture on oxytocin and its uses both in the human and animals. What is the physiology of oxytocin, from where it is secreted, how it is synthesized, what it causes. This hormone is having a very short half-life period, that's why it is very difficult to estimate this hormone. And this hormone has several targets. I am writing few options, just go through the options and find out what may be the appropriate one. A. Endothelial cells. B. Astrocytes. C. Thyroid follicular cells. D. Myoepithelial cells. These are the 4 options. Now find out the answer. Take 3 seconds, 4 seconds. This question is about oxytocin, which is known as the labor hormone, the love hormone. This hormone is known as the milk letting down hormone. It causes the sperm aspiration, that's why known as the sperm aspirating hormone. Lot of functions are there, we'll discuss. Now question arises, in this question, what is the target cell? Students, target cell means that cell which contains the receptors for that hormone, so that when the hormone will come, it will bind with the receptor for further signaling inside the cell and come out with the hormone function or the effective function. Endothelial cells are the inner lining of the blood vessels, and they are the cells which usually do not show the receptors for oxytocin, and the functions of the oxytocin in the blood vessels are not defined. That means in this question, endothelial cells are not the choice, appropriate choice. Astrocytes, these are the cells which are glial cells, supportive cells, non-neuronal, non-excitable. They are having lot of function, lot of metabolic function, calcium homeostasis, blood-brain barrier. They are present in the central nervous system. They do not have the receptors for the oxytocin. They are independent to oxytocin function, and rather I can say oxytocin is not having a defined receptor on astrocytes. Thyroid follicular cells, the predominant cells of the thyroid gland, the thyroid follicle, from where this thyroxine hormone is being synthesized and secreted. Oxytocin is not known to have its receptor on the thyroid follicular cell. So not the thyroxine or thyroid associated hormones are secreted in relationship with this. So thyroid follicular cell obviously is not the answer. Myoepithelial cells or the basket cells, actually these are the cells which are present in the mammary gland. They are present in the in the alveoli, and they are the cells just present surrounding the alveoli. Alveoli are the structure in which the milk is synthesized, and surrounding them these basket cells are present, or the myoepithelial cells are present. They contain the contractile filament, the actin and the myosin, and they are contractile in nature because of the receptor for oxytocin. So when the oxytocin is being secreted due to the milk letting down reflex, we'll discuss under neuroendocrine reflex, then this myoepithelial cells, they contract and they contract the alveolar cells, and then the milk come out. So this is the alveolus. Then these are the alveolar cells or the alveolar epithelial cells where the milk is being synthesized. It is the lumen of the alveoli, and these are the basket cells or the myoepithelial cells. And they are the cells which are contractile in nature. They are the cells which are containing the receptors. And once the oxytocin binds here, they contract and they contract to ooze out the milk. So milk letting down reflex is carried out by this myoepithelial cells in response to the hormone oxytocin. So in this question, the answer is the myoepithelial cells. So it is a level 2 question. It's a very important question. So with this first physiology explosive series comes to an end. I hope that you people have enjoyed my explanations, my questions, the way in which I have explained. I tried my best to show that whenever you are getting questions, be focused on the point, not to directly answer the question, rather to understand why not the others are answers, so that you can get the best possible answer, and without any confusion, you can pull out the right answer. So stay tuned for the next explosive series of physiology on Thursday. I will come with another 10 questions, and they will be level 2, little bit high. We have to think by our brain what should be the answer, and they will come in mostly in the higher grade examinations. So thank you so much for your patient hearing, patient interaction, and I need to see in the chat box what kind of problems you are facing, what more you want. So if you really like this, please subscribe the channel, like the channel, and come once again. We'll have a great interaction. Till then, take care of yourself and enjoy physiology learning. Thank you so much.